Thank you very much at magandang araw mga kaibigan. Nagbabalik po ang inyong programang Aksyon Central Luzon Special Edition. At alam niyo naman po, we have a project with the Angeles Medical Society, no? At ang tungkol po sa kalusugan ang pinag-uusapan natin. At siguro natatandaan niyo, just very recently, one of the more watched na edition na ginawa po natin yung tungkol po sa ito nga po, heart surgery. Kaya po meron po tayong part 2, no? But before that, I'd like to introduce my co-host, no? Lagi po nating kapartner, naghahanap po ng mga guest at kung anong dapat pag-usapan, si Dr. Rowie Medina. Ma'am, welcome.
Hello. Hello, Central Luzon. Hello, Sunny.
O, pakilala na natin itong ating special guest, no?
Please do the honor.
Oo. Mga kaibigan, ito ang aming special guest. Nasa Manila, nasa Angeles po, no? In fact, nagkiklinik po siya sa Philippine Heart Center at saka sa Angeles University Foundation Medical Center. Fellow po siya ng Philippine Association of Thoracic and Cardiovascular Surgeon po siya, mga kaibigan. At nagkiklinik ka rin dyan sa Capital Medical Center at saka po sa Chinese General Hospital. Ang ating pong panauhin, si Dr. Rector Villajuan. Sir, welcome.
Magandang hapon no, sa inyo lahat.
Oo. So, di ba napag-usapan na natin ng konti ito?
Yeah, yung first episode natin, if you remember, it's with Dr. Payumo and Dr. Frigiliana. It's all about heart attack.
Right.
But this one, yung una kasi, yung mga non-invasive procedures or kung sino yung mga pwedeng magka-heart attack. Ngayon, nandun tayo sa medyo part na hindi naman nakakalungkot kasi meron pa rin naman solusyon. So, si Dr. Villajuan ang magbibigay ng solusyon sa atin on yung mas invasive na procedures ng bypass.
Although at that time, discuss natin ko konti, no?
Konti
Parang
lang.
passing lang.
Ito talaga, siya
Pero
yung
ito-
siya yung expert on this one.
Oo.
So,
So how long
Dr.
have you been in
Villajuan.
this, Doc?
Well, I graduated from training 2006. So since then, nasa private practice na ako.
Okay. So meron ka rin, nag-aral ka rin sa abroad about this or did you go to
Well, primarily at the heart center.
Heart Center?
Yeah.
So talagang pampuso ka talaga.
Yeah.
yung last episode namin, our title was Be Good to Your Heart. So
Oo.
ngayon, after being good to your heart, tapos meron pa rin nakita or meron talagang wala na tayong magawa. So we want to start with statistics, no? So we want to ask Dr. Villajuan kung yung bypass, so ilan ba yung ginawa natin dito sa Pilipinas compared dun sa ginagawa na nila sa, plating comparison sa America?
Sa Amerika, yeah. In comparison to the United States, marami talaga sa Amerika kasi they have the means, tapos early diagnosis. So, kung nagpa-follow up sila mas regular sa doctor, mas nadadiagnose sila na mas maaga. Pagkatapos, siyempre, socialized yung medicine nila.
Yes.
Kung candidate ka talaga, doon ka tutungo sa operasyon kung kailangan talaga. They have around 400,000 cases a year of bypass surgery in the United States. Dito sa atin, from the last census ng Philippine Heart Center, around 500 to 600 cases lang a year. So mababa ang comparison natin.
Because
Siguro,
probably we don't have those in the US.
yes, hindi tayo socialize. So kanya-kanyang budget sa pagpapagamot. Una, sa pag-diagnose, usually darating ang pasyente, sakit ng dibdib o may iba ng problema. Pag na-diagnose, sinabing kailangan pa opera, dahil walang budget, hindi rin na-operahan.
Hindi rin na-operahan, no?
So mababa yung census natin.
Okay, gusto ko lang ho, no, as a reminder, ito ho aming ginagawang programa ni Doktora dito with the Angeles Medical Society. Hindi ho kami nananakot. Kasi yung iba na, marami nagpo-opera sa breast, na-remind nga sila, no? Yung iba-iba pa, no? At marami rin naman na nagpapacheck up. Pero yung iba natatakot. Pero that is not the purpose why we're doing this program. We want you to improve your condition and we want to save lives.
Yeah.
And also for prevention. So
Prevention,
we wanted to get it at an earlier stage or so going back with the bypass, Doc, who are your patients ba candidates for a bypass?
Yung sa diagnosis, so we have to go to bakit nagkakaroon ng heart disease. We call it the coronary artery disease. Yung pinakaugat ng puso, nagkakaroon ng bara, nagkakaroon ng problema. leading to yung nawawalan ng blood supply o oxygen supply sa part na yun ng heart. So yung usual na nararamdaman nila, masakit ang dibdib, madali mapagod, hinihingal, tapos meron bang iba na nag-iba yung pallor, you call it,
kulay nila.
Nag-iba yung kulay.
Yung skin.
So, maraming simptomas. Pero pag diagnose na, meron tayong mga ginagawa, isa na dyan yung ECG. Pero sabi nga natin, kahit na meron kang coronary artery disease, kahit ginawa ka ng ECG, hindi pa rin makikita lahat. So
how will you determine?
Next step.
Next step, yes.
Yeah.
What is the next step after ECG?
Dahil ang problema, barado yung ugat, you have to simulate yung heart mo na parang under stress siya para makita na kulang yung supply dun sa parting yun ng heart. So, other than ECG, we have to request stress testing. Either it be stress testing or dobutamine stress testing, depende na yun sa cardiologist. And then, pag may positive findings doon na darating sa angiogram.
Angiogram. So yung mga procedures para ma-solve yung problema.
No, diagnosis pa rin yan.
Diagnostic pa
Okay.
siya.
Para malaman kung may bara o wala. Pag nalaman na may bara, then you go to the options.
Okay.
One option is angioplasty.
Angioplasty.
Yung sinatawag natin angioplasty, may papasok na wire tapos ibabalon nila yung part na yun na nagbara. From there, i-decide kung kailangan i-stent, maglalagay ng stent or bypass na. Sometimes angioplasty is just a temporary relief. Pero kailangan maglagay ng stent, ng metal stent, to make it a permanent thing. And then, yung iba, pag mas maraming bara, siyempre mas maraming gastos, mas maraming diretso na ng bypass.
So, depende sa dami ng bara mo, yun yung mas
Depende pa rin
magastos.
sa dami ng bara.
Merong quadruple, di ba?
Quadruple yun tinatawag natin mas maraming nilagay na bypass. Pero usually, either it be a one vessel disease,
one
two
vessel
vessel,
disease.
or three vessel disease.
What's the usual that we have experienced? Anong
What I know sa AUF,
AU dito sa atin?
from October to February of this year, they have had around 30 cases ng three vessel disease.
30
So
cases?
marami yun. Actually, napansin ko nga sa mga Kapampangan, mas marami talagang
Oo.
may sakit sa puso.
Which goes to my next question, risk factors nila, yung mga most common na mga binabypass nyo. Ano yung mga common risk factors nila?
Yes, going to the risk factors, siyempre, nandiyan yung age. Number two, siguro, we could say na predominant is yung hereditary, yung genes.
Genes nila.
Kung tatay, kamag-anak, meron, yung possibility magkaroon ka rin.
Sa immediate family, pag
Yes.
merong tinamahan, gano'n.
Yes.
So,
And then,
kandidato ka na rin.
so mag-ingat-ingat ka na.
Oo.
Gumawa ka na ng drastic measures. Other risk factors includes smoking,
Okay.
tapos kung diabetes ka, so family history pa rin. Kung
Oo.
may diabetes sa family, tataas din ang risk mo. Obesity,
Oo.
yung tinatawag natin na hypercholesterolemia, risk factors.
Yung
yun
mataas
yan.
na presyon.
Yes, also the hypertension.
So, some of this you can medicate, di ba? Or you can,
In the early prevention, you
Oo.
could medicate. Pag nakita na may bara na, you just have to decide.
how long ba yung hardening? How long will it take for
Before they get patients late na in life, 60s, 70s. Ngayon, pabata ng pabata.
Pabata na, oo.
We get patients as early as 30, in their mid-30s up. So, yung mga 40 years old na patients, madalas na ngayon. Dati, medyo,
Oo.
gaano ka.
Di pa sila ninenervyos, no?
Lifestyle change kasi
Yes,
younger people now are mas stressful ang kanilang mga
Yan, isa
lifestyle.
rin yan. Stress is a risk factor. So, kung babaguhin, talagang lifestyle modification.
Lifestyle modification. So, ayan, no? Siguro ho, naririnig nyo sinasabi ni Doc. narinig niyo yung sinasabi ni Doktora, paulit-ulit po tayo, hindi na tayo kailangan umabot sa ganyan, di ba? Kung may pagbabago
May pagbabago.
sa buhay natin, no?
Yes. So, ano yung usual na ina-advise ng mga doctors?
Oo.
Actually, it's a triad of 1, exercise, 2, diet.
Okay.
Siyempre, lalo na kapampangan, mahilig sa maalat,
Matamis.
matataba, matamis,
Sausawan.
sausawan.
Sa pagkain.
Yung pagkain pa rin. And then, we go to the medication. There are medications, very good medications that will help us in fighting or in trying to prevent the occurrence of coronary artery disease. Like what? You might ask. One is aspirin.
Oo.
Aspirin, yung iba kasi nire-recommend nila, 40. Pag may risk factors ka, mag-take ka na. Also, if you have high levels of cholesterol, kailangan kontrolin yun. Kasi most of the components ng plaque, cholesterol-based pa rin. So, mga statins, yan.
Pero hindi ba kuminsan sa genetics din yan, di ba? Kahit anong gamot na gagamitin mo, hindi bumababa o kung bababa, konti lang dahil lahi ata, gano'n.
Nahi, pero kung hindi ka rin magte-take,
Oo. Mas lalong delikado.
mas delikado.
Naku.
But of course, we would like to tell them that they should not self-medicate with aspirin. Even if
Yeah.
we tell you that aspirin is good, you still have to go to your doctor.
You have to go to your doctors and decide, let the doctors decide if you need the medications.
So aside from the medications that they would take after going to your doctor, of course, so what are other treatment regimens or options for coronary artery disease?
Yes, when you have been diagnosed with coronary artery disease, if we go to the bypass, kasi nasa surgeon ako, kung bypass na talaga yung kailangan mag-undergo ka, one, kailangan, kasi it's a major operation.
Major.
Dapat ready yung patient, not just emotionally, financially, and then kailangan malaman din niya yung possible outcomes of surgery.
Yes, the risk.
The risk. There are a lot of risks for a major surgery. Ano na yung mga possible risks? One, bleeding. Pangalawa, heart arrhythmia. So, magkakaroon ng changes in the rhythm, in the rate. Pangatlo, organ dysfunction. That could be a risk. And then, brain dysfunction. Possibility pa rin yan. And then,
Pwede bang matake ka after the surgery?
it happens.
Yes.
Tapos yung stroke?
Stroke, it happens. So, may rates naman with regards to the risk. Here at the Philippines, the Philippine Heart Center, the rate is around 3%. So, pag nagkaroon ka nag-bypass ka, yung possibility na magkaroon ng problema nasa 3%. Sa 100 na pasyente, 3 hanggang 4, 5 nagkakaroon ng problema. It is comparable with the results that they have in the United States. So, pareho lang tayo. You don't have to go to the States to have it done.
Kayang-kaya na
we're
natin.
doing it here, and we're doing it here in Angeles.
Angeles,
We're doing it here in
So you said from October. So when did you start doing bypass surgeries here in
We
Angeles?
started, mag-1 year na.
So for 1 year, you've done around 50 cases?
No, not that much.
Not
Kasi
that much. Ilan?
maraming nadadiagnose, yun nga yung problema.
But
Dahil sa budget siguro, dahil sa...
Magkano ba yan?
Yung concept.
very important question.
Oo.
For the package, kasi under package pa rin ang ano ngayon ang sa AUF. Yung package ng bypass is around 550 to 600.
Bawat ano yan?
Yeah.
That's
Total
the
ano
whole
yan?
package.
Total na yan.
That's
Okay.
550,000.
Yeah. Kasama na lahat.
That's the kung walang ibang complications.
Yes.
So yun yung
Elective.
more or less, yun lang ang eyeball na price nila. So
Pero sinasagot na naman ng insurance ata, yung mga health insurance.
Yeah.
Meron naman,
you'll get some deductions from
Deductions,
PhilHealth,
right.
Deductions, but not total.
not total.
Kasi may limit din ang insurance.
But it's still more cheaper. It's cheaper here in Angeles, or
Yeah,
is
we
it
made it a point
comparable
na
to Manila din?
It will
Tama.
be cheaper compared to Manila. We made the Basis Heart Center kung magkano yung presyo nila, bababaan namin. Kasi right now, heart center pa rin yung pinakamura.
Yun, tsaka yun ang puntahan talaga, di ba?
Yeah.
But if you sum it up kasi, so you don't have to go to Manila.
Yes.
Bring the whole family there, yung
Kasi
magbabantay
yung
sa'yo,
gastos mo,
yung
dodoble.
food mo, transportation nyo doon, and accommodation nyo.
We just go here for you.
Oo.
Punta na lang
Kayo na
kami.
lang ang...
And plus, you're a Kapampangan naman. You're a Kapampangan
Yeah. Oo.
doctor. So you're just going back to your hometown.
Yeah. That's true.
It helps.
So,
So Doc, aside from, so kung dun sa, so available yan sa
Pero AUF lang gumagawa niyan in Central
Yeah.
Luzon so far.
Because
So,
we're the only one capable for, we have the CAT lab
Yeah.
that was introduced last year lang.
Yes. Mhm.
so yun nga, right now, the whole of Central Luzon, AUF lang ang meron.
Capable.
And even North Philippines? Well, I mean North Luzon?
North
North of
Luzon, I
Manila.
think Baguio,
Baguio, they
has
have
its
it.
own, ano.
But here in our area,
Yeah. So for the nearby provinces, Bataan,
Yes.
Tarlac,
Tarlac,
Vizia,
oo.
Bulacan,
and even some Metro Manila residents, pwede rin
yeah,
siguro
kung
dito,
gusto
di
na
ba?
mas mura, they can
Oo.
go over.
Or if they have relatives here na, di ba?
Balikan. Sila pupunta ng Angeles for the procedure.
Di
So,
ba kasi pinag-usapan natin nun, pag nagkasakit ka nung unang panahon, o mamamatay ka na lang, parang kulang.
That's true.
Kung di ka nagpunta ng Manila, wala na mangyayari sa'yo. Pero ngayon, nandito na po ang marami sa mga equipment, yung expertise, yung
Yes.
kagaya ko rin na doktor. Muuwi pa dito yan para manggamot at mag-opera, no? Nandito ho, mga kaibigan. Pero yung gamit sa AUF, moderno naman yan, di ba?
Yeah, nagulat nga ako because they're all new, bago lahat. So,
Oo.
mas bago pa nga doon sa ibang hospital sa Manila.
Mhm.
So, that's one thing we could be proud of.
Okay. So, sabi mo kanina, yung mga Kapampangan, maraming nagkakaganito?
Yeah, before nung tinayo yun dito sa AUF, especially nung training pa lang ako sa heart
Oo.
center, ang dami namin pasyente mga Kapampangan.
Naku.
One thing that struck me was, bakit Kapampangan mas marami?
Sa sex, meron bang, I mean, may babae, mas marami lalaki nagkakasakit.
Actually, mas madalas
Sa lalaki pa rin?
Lalaki. Kasi ang babae, medyo protected siya because of the hormonal thing. Ang sinasabi nila, 10 years ang protection ng hormone.
Ng babae?
But then, may drawback yun kasi yung babae, pagka nagkaroon naman ng sakit sa puso,
Mabilis.
mas mabilis at saka mas
Deadly.
masama yung outcome kasi babae, mas maliit ang coronaries. Technically, mas mahirap operahan. And then, mas mabilis silang magbara
Okay.
later on in life.
so pero gaano sila katagal nagsistay sa ospital?
The usual stay is around a week after the procedure. So, nag-stay ng 5 to 10 days depending on the recovery period. Iba-iba pa rin.
Iba pa rin yung rehab, di ba? Meron pang
Yes,
partner
after
rehab.
that, we recommend to undergo rehab kasi mga pasyente, hindi nila alam kung ano yung gagawin nila after the procedure. Kung pwede na sila magbuhat, pwede na sila mag-sex, pwede
Oo.
nang bumalik ng mag-golf.
Tama, oo.
So, ang usual recommendation is around 6 weeks. Medyo pahinga muna yan. Gradual exercises, walking lang. And then, after 6 weeks...
Pakunti-kunti.
Yeah.
Pakunti-kunti muna.
Una, 15 minutes, and then
Oo.
the next day, 20.
Oo.
And then, hanggang makarating ng
Graduated
30
talaga.
to 1 hour.
Pero
Lakad muna.
Okay. At sasabihin ng iba, yung mga ano, ba't ako magre-risk yan? Importante, walang nabubuksan sa akin.
Yeah.
Di ba, ugali ng mga Filipino yan, ayaw nilang pabukas.
Yun nga, pag na-diagnose sila na may problema sa puso, may bara sa ugat, sabihin nila, Dok, gamot na lang.
Oo, tama.
Siyempre, ayaw nung pa-opera or ayaw gumastos.
Oo.
Yung symptoms mo mawawala sa gamot. But then, yung heart mo, nagpe-fail. Kaya dumarating yung time, hindi ka na rin pwedeng operahan kasi yung ang taas ng risk. So, at the same time, yung congestive heart failure ka na.
Okay.
Hindi na kayang gawin.
So, the earlier, the better.
Plus, there's going to be a lifestyle change after the
Yes.
operation, right?
Lifestyle change definitely after. Kasi yung nilagay na bypass, na mga conduits, hindi sila lifetime na tatagal.
Okay.
Tatagal sila kung naggagamot ka. That's why aspirin...
So, religious pa rin yung
religious
paggagamot.
pa rin. Actually, if we go by statistics, yung isang ugat, yung artery na isang lalagay, At 10 years time, bukas pa rin yan 90% of the time. Pero yung veins, nasa 60 to 70% na lang.
Okay.
Pero kung hindi ka inom ng gamot, bababa yung 60%
Bababa.
pa yun. Pero kung inom ka, it could go to 80% at 10 years time.
Okay.
Meron ibang nagawa kami before, na-operahan siya way back. So, mga 20 years na. So, matagal na yon for re-operation or redo operation.
Okay. So, itong lahat ng ginagawang ito, no? Yun nga, para maging komportable yung buhay. Kasi, sabi mo nga, pag hindi mo ginawa ito, pagdating ng araw na gusto mo na pumapayag ka na, baka hindi na
It's
ubra.
too late.
Yeah.
It's too late.
Yeah. That's true. Pag dumating na yung nasa congestive heart failure ka na, yung heart mo, yung function ng ejection fraction, mababa na, hindi na siya maka-push ng blood to the different
Yung
part
bomba,
of the...
mahina na ng...
Yes. Yung risk, napakataas na. Tapos yung recovery, napakatagal.
The older you get ba, tumataas din yung risk, Doc?
Yes, pero we've done patients as old as 80. So, nailulusot naman.
Gusto pang mabuhay ng matagal, no? So,
Basta, depende pa rin. Basta
Their activity before.
strong 80.
Strong 80.
70s. Magandang candidate pa rin.
sabi mo kanina, 10 years, okay pa yon. Yung nilagay, o kaya yung ginawa,
Yeah.
10 years.
60% yon na bukas pa.
Functioning.
So,
That's a minimum.
so yun ang parang nadagdag sa buhay mo. Kung if you don't...
Minimum na Pero kasi meron isa
Minimum,
na tatagal pa eh. So, hindi lang 10 years. Mas matagal pa yun.
Minimum na.
Minimum
Okay.
na.
Okay, let's have a break, Doktora, no?
Okay.
Mga kaibigan, magbe-break lang ho kami, and after the break, we will continue with the discussion with Dr. Villajuan, no? At Rector, no? Rector?
Yeah.
Parang dalawang trabaho niya, doktor at saka rektor, no? Anyway, marami pa ho tayong tatanong. Ito ay napakahalaga. Kaya po, kung minsan, kinukulit po natin ang napaka-busy rin si Doktora Rowie para maghanap po ng mga magagaling na mga doktor. Ang hirap nga sa mga nahahanap niya, kung minsan ang hirap introduce dahil ang haba-haba po ng yung kanilang qualification, no? Kung saan sila nag-aral, kung ano-ano mga pinag-aralan nila. Pero talagang pinipili po niya para once they're here, mas libu-libo po ang makikinabang dito po sa information, sa education part na binibigay po ng ating programa at ng Angeles Medical Society. Babalik po kami.